Influenza by Grant Hardin and Bo Daniel. First off, the type of virus that it is, as previously stated, influenza. It affects the nose, throat, lungs, and many other things, but those are the main three. It spreads through air and direct contact. Examples of air would be coughs and sneezes, and examples of direct contact would be handshakes and hugs.
Some of the characteristics of influenza. The shapes would be spherical or filamentous, 100 nanometers in diameter. The filamentous forms often in excess of 300 nanometers in length. The type of pathogen is a retrovirus. Some of the hosts. Animals consist of birds, pigs, horses, ferrets, and dogs. Some more hosts would be cats, marine animals, but plants are not affected by the influenza virus. The life cycle of the flu. Step 1. It enters the host cell. Step 2. It enters the VRNPs into the nucleus. Step 3. Transcription and relocation of the viral genome. Step 4. It exports of the VRNPs from the nucleus. And step 5. Assembly and budding at the host cell plasma membrane.
Symptoms. Some symptoms of an influenza infection include pain in muscles, cough, chills, dehydration, and fatigue. Some other symptoms include fever, flushing, loss of appetite, sweating, body ache, congestion, and runny nose. And if there already wasn't enough, here's even more symptoms: sneezing, chest pressure, headache, shortness of breath, and finally, sore throat. Where in the body does influenza infect? Influenza infects the whole body negatively. Specifically, it affects the nose, throat, lungs, and sinuses.
Some of the treatment for influenza. Influenza can be treated with lots of rest, lots of fluids, over-the-counter anti-inflammatories, and of course, the flu vaccine.
Diagnosis. Influenza is diagnosed via viral culture, serology, and rapid antigen testing.
The transmission. Influenza is transmitted through airborne respiratory droplets such as coughs and sneezes, skin-to-skin contact, saliva, and commonly touched surfaces.
And finally, prevention. In order to prevent contracting influenza, you should wash your hands frequently, get the annual vaccine, and sneeze and cough into your elbows. Thank you.
Have a great day.